MS is believed to be an autoimmune condition in which the immune system is excessively active and attacks the nervous system. The central nervous system is the part of the nervous system involved with multiple sclerosis. The central nervous system includes the brain and the spinal cord. The nerves in the central nervous system communicate with each other through a long wire-like process that have central fibers or axons surrounded by myelin. In multiple sclerosis, the immune cells produce inflammation, and that injures the myelin. In addition, damage occurs to the axon. This process occurs in aging-related neurological diseases such as Alzheimer's and Parkinson's disease also. The symptoms of MS are highly varied, but they frequently include pain, muscle spasticity, fatigue, inflammation, and depression. These are symptoms that can be directly targeted using alternative medicine. CBD or cannabidiol supplementation, for example, may be advisable for MS to help to reduce fatigue, pain, spasticity, and ultimately improve mobility. Capsaicin derived from hot chili peppers. The capsaicin may be useful for some people in relieving pain. It's been shown to help to reduce urinary incontinence by reducing spasms, and it also helped to double the peak bladder capacity. Ginger has been shown to help with pain relief, and it's a powerful anti-inflammatory also. Valerian has an anti-spasticity effect. Chamomile has numerous benefits, one of which is of benefit to the multiple sclerosis patients, and that's the anti-spasticity effect, and it's also anti-inflammatory. Panax ginseng was shown to help with the fatigue that's associated with multiple sclerosis. Salvia officinalis was also shown to improve cognition. Curcumin has an anti-inflammatory property, and it's been shown to benefit MS patients. Oregano also has anti-inflammatory properties and also antifungal properties. Therefore, it can be beneficial to MS and its related conditions such as candida overgrowth. There appears to be an association between multiple sclerosis and candida. As a result, controlling candida may improve some of the symptoms of patients such as the fatigue that's associated with the MS. You can see my other video on candida for more information about this. St. John's wort has antidepressant effect on patients with MS, and it can also help with the neuropathic pain. However, it can also cause drug interactions with conventional medicine that's used for treating multiple sclerosis, so caution is needed. Saffron had antidepressant effects, while also delaying the onset of autoimmune encephalomyelitis. A B12 deficiency can mimic the symptoms of MS. B12 is required for the production of the myelin sheath, and a deficiency can then lead to improper myelination. Therefore, B12 may be helpful to patients who are experiencing MS. Be aware that a B12 blood test is not reliable, as food is now fortified with folate, and this can give a false B12 reading and hide a deficiency. The best form of B12 would be injections, or else oral sublingual methylcobalamin at 5,000 micrograms per day. Scientists have discovered that vitamin C promotes the repair of the myelin sheath surrounding neurons, making it a potential treatment for multiple sclerosis. The best orally available form of vitamin C would be liposomal vitamin C. After that, a non-acidic form would be recommended, with the least useful being cheap ascorbic acid. Vitamin C's action is also enhanced by taking bioflavonoids. Because vitamin D becomes active with sunlight exposure, those who live farther from the equator, who have less direct sunlight exposure, may have lower levels of vitamin D and be at higher risk of developing MS. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly to correct any deficiency. Vitamin K2 was shown to be depleted in patients with MS also. Vitamin K2 works synergistically with vitamin D, therefore supplementation of a K2 and D mix may be of benefit. A recommended dose of K2 would be 300 micrograms per day. Therapies for the symptoms include medication-based and non-medication approaches, such as physical therapy, occupational therapy, speech therapy, and psychotherapy. Common MS symptoms that are treated using these therapies can include the fatigue, depression, weakness, incoordination, walking difficulties, stiffness, and bowel and bladder disorders. Gluten sensitivity was observed in patients who were suffering from multiple sclerosis. An intake of fruits, vegetables and legumes, whole grains, added sugars, and red processed meat consumption in patients with MS was assessed, and it was determined that patients who consumed more fruit, vegetables and whole grains had less symptoms of pain and depression than those who consumed high levels of sugar and processed meat. Since antioxidant vitamins like A, C and E lessen the cell damage by free radicals, some researchers believe that they can help improve MS. Vitamin B1 or thiamine is one of the most relevant vitamins in obtaining energy for the nervous system. A thiamine deficiency or a lack of activity causes neurological manifestations, especially symptoms of depression, which are intrinsic to multiple sclerosis and related to its pathogenesis. A conventional use of deer velvet in New Zealand and Australia has been to ameliorate the pain and the inflammation of arthritis, joint pain, back problems and muscle fatigue or weakness. It's regularly used for post-operative recovery of patients in Russia. It's been scientifically proven to provide some of the following benefits. It improves the immune system functioning. It improves athletic performance and strength, improves muscle recovery after exercise, controls blood pressure, and it increases hemoglobin in the blood. It's an excellent natural supplement for women's health. It provides vitality and anti-aging properties for seniors. It's an alternative natural supplement for bodybuilding and weight training. It's a superior source of growth factors. It enhances sexual function for both men and women, and it's a natural supplement for arthritis and gout. Colostrum contains growth factors that can help to slow the aging process in anyone who takes it. It also helps to stimulate wound healing, cartilage and nerve regeneration, which is helpful in cases of multiple sclerosis, Guillain-Barré syndrome and its variants. Grapeseed extract is one of the most powerful antioxidants ever discovered. It has numerous health benefits that dramatically extend your lifespan and improve your quality of life. Some of the benefits of grapeseed extract: it strengthens and repairs connective tissues. It helps patients with multiple sclerosis. It helps teeth and gums. It reduces allergic response by minimizing histamine production. It enhanced capillary strength and vascular function, reduces blood pressure and cholesterol levels, helps to prevent cancer, strengthens the immune system, increases peripheral circulation, improving vision, and it reduces skin aging and the loss of elasticity. CoQ10 supplementation at 500 mg per day can improve depression and fatigue in multiple sclerosis patients. The antioxidant and anti-inflammatory activity may also be considered as one of the main factors that's responsible for the anti-fatigue and antidepressant effect of the CoQ10. CoQ10 is also enhanced when it's combined with 20 to 40 milligrams of PQQ per day. You can look at my other video on mitochondrial boosters for other supplements that will have similar benefits. Omega-3 fatty acids contain two compounds, EPA and DHA, and these are believed to decrease certain inflammatory responses in the body. This is why omega-3 supplements are often prescribed in conjunction with rheumatoid arthritis therapies. Since MS is an inflammatory disorder which causes progressive damage to the central nervous system, scientists have long explored the hypothesis that omega-3 fatty acids may somehow impede the progression and/or the severity of the disease. Doses can range from 3 to 9 grams per day of an EPA DHA omega fish oil blend. You can check out my video on the related condition Alzheimer's disease, and my video on CBD for more information about dosing and its benefits to blood flow in the brain. You can also check out my website for more videos on the individual herbs and supplements talked about in this presentation.